Today we are going to study about the attachments of the radial bone. So this is the radius bone and we are going to see the muscles attached in it. So first is the flexor digitorum superficialis. This muscle you can see a line. This is a flexor digitorum superficialis. The radial head of flexor digitorum superficialis takes origin from the anterior oblique line and the upper part of interior border. Next is the flexor pollicis longus. This muscle is the flexor pollicis longus, which takes origin from the upper two-thirds of the anterior surface of the radius. Now we will see the muscles which are getting inserted into the radial bone. First is the biceps brachii. This in the radial tuberosity. Bicep brachii is inserted into the rough posterior part of radial tuberosity. The anterior part of tuberosity is covered by bursa. So the posterior part of radial tuberosity gives insertion to bicep brachii. Second is the supinator. This is the supinator. Supinator is inserted into the upper part of lateral surface of the radial bone. Next is the pronator teres. This one is the pronator teres and is inserted into the middle of lateral surface. This is the brachioradialis. Brachioradialis is inserted into the lowest part of the lateral surface just above the styloid process. This is the pronator quadratus and is inserted into lower part of anterior surface and into the triangular area on the medial surface of the lower end. So this is all about the muscles which are attached on the anterior surface of the radial bone, and here you can see the radial artery which can be palpated for radial pulse as it lies on the medial to the sharp anterior border of the radius, lateral to the tendon of flexor carpi radialis. So this is the posterior aspect of the radius bone. Here we can see this one is the biceps brachii getting inserted, supinator, pronator teres. This is the abductor pollicis longus and this is the extensor pollicis brevis, which are arising from the posterior aspect of the radius bone. So this is all about the important muscles which are attached in the radius bone.